I'm Dr. Po. Today we'll be doing the examination of the hips. We're grateful that we have Mr. Ao today who's kindly volunteered to be a mock patient with us today. So first of all, we will start off. Hello, Mr. Ao.
Hi.
I will be examining your hips today. Would that be all right?
Sure.
I'll get you to lie flat on the examination couch. First of all, we'll observe from the end of the bed with the patient lying as flat as possible, assessing for symmetry. For example, in a fractured neck of femur, the affected leg will be shortened and externally rotated. Also, examine for any obvious leg length discrepancy. If there's any leg length discrepancy, this can be further confirmed with measurement. We will take the measurement from a fixed point, such as the anterior superior iliac crest to the medial malleolus of the ankle. And this is compared to the other leg. Any obvious difference will indicate a real leg length discrepancy. Thereafter, we'll look for any fixed flexion deformity of the hip. Mr. Ao, I'll just be examining your hips. We'll examine for any obvious scars around the hip. The greater trochanter should be palpated for tenderness. How does it feel? And the same thing is repeated for the other side of the hip, looking for scars and the greater trochanter palpated for tenderness. Now we'll go on to movement of the hips. Just relax your leg for me, Mr. Ao. Full flexion of the hip is assessed together with internal and external rotation with the hip and knees at 90 degrees. This is compared to the other side. Full flexion together with internal and external rotation. Thomas's test examines for presence of any fixed flexion deformity of the contralateral leg. This is done with the hip in full flexion. The examiner's hand on the back of the patient to ensure that the lumbar lordosis has been eliminated and the contralateral leg is observed. The test is positive if the leg is lifted off the couch. Now, Mr. Ao, I'll get you to stand on the floor for me. The Trendelenberg test is assessed with the patient standing alternately on one leg. This assesses the hip and the gluteal muscle strength of the leg they are standing on. At the same time, the gluteal bulk could be examined as well. Mr. Ao, I'll get you to stand on your right leg. In a negative test, the pelvis remains level or even rises. In a positive test, the pelvis dips on the contralateral side. Now you can put both your feet on the ground. Thank you. Function is assessed by getting the patient to walk. Mr. Ao, I'll get you to walk towards the door. A waddling gait can sometimes be seen in hip pain or proximal muscle weakness. We'd like to thank Mr. Ao for his time with us here today. Thank you, Mr. Ao. We've come to the end of our hip examination video for today. Thank you.